Good day, ma'am. I am your student nurse, Eliza Rosales, and today I will be the one to assess you thoroughly in order for us to check your health status. Is that alright with you?
Good morning din. Yes, ayos lang sa akin.
Okay, so before we proceed po, I must inform you that I will be asking very personal questions so that the medical professionals will be able to have an accurate diagnosis regarding your concern. And rest assured po na everything will be treated with respect and confidentiality. So I hope that you will cooperate by answering with full honesty.
Yes, I am more than willing to cooperate.
So that's good to hear then. I'm just going to wash my hands over there and I will start with the assessment. Before the actual assessment, I would like to begin by asking some questions, and the first one is, before we start po, may I know if you have any visual or hearing impairments that may hinder this interview?
No.
Okay po, that's good to hear then. Ngayon po, will you please tell me your name and also your date of birth?
I am GBD and I'll be turning 72 this July.
Okay po, and how would you like me to address you?
You can call me Lola Nene or Mama Nene.
Okay, Lola Nene. Proceeding po, how old are you again?
I'll be turning 72 this July.
What is your ethnicity?
Filipino.
What is your religion po?
I am a Catholic.
Your marital status?
I am a widow.
Are you currently employed?
I am retired from a government job.
Okay po. What is your present address, ma'am?
San Isidro, Nueva Ecija.
Okay, may I know about your contact information?
You can contact me through my mobile phone 0966-742-3135.
Now, what seems to be the problem, ma'am?
I was advised by my doctor to have a check-up due to my thyroid disorder, which is said to have an effect on my sugar.
So, is it your first time having this problem?
Yes,
For how long have you been experiencing this?
since Feb of 1995.
Oh, matagal na po pala. Are there other symptoms you're experiencing right now?
None.
Okay. Have you ever received medical care regarding these issues?
Yes, I have.
Okay. Were you hospitalized due to these problems you're experiencing right now?
No.
Okay. How about before, when you were a child?
No.
Have you ever been rushed to the hospital in an ambulance?
No.
Proceeding, do you have any psychological problems?
None.
Have any allergies?
None.
Do you have any current medications?
I am currently taking maintenance for the thyroid and for diabetes.
What are those medicines po?
Euthyrox for my thyroid and Janomet and Lupimet for my diabetes and some multivitamins.
What is the prescribed dosage?
Okay, what is the prescribed dosage of it?
Euthyrox is 25 mg once a day, 100 mg every Monday, Wednesday, Friday of Janomet taken once a day, and 2 or 500 mg of Lupimet every Tuesday, Thursday, Saturday taken once a day.
Okay, how do you take those medicine?
I take it orally.
Oh, so you swallow it. And what is the reason why you're taking that medicine?
It is prescribed by my doctor.
Yes. For how long will you take it?
It changes depending on the effect it gives me. I've had different prescriptions before, which was changed because it gave me different symptoms.
I see. Do you think that the medicines are working?
Yes.
Yes. Are there any side effects you experience after taking it?
None.
That is good to hear, ma'am. And aside from those, you may have been taking this, what they call forgotten medicines. And would you please help me identify if you are using this right now?
I have not been using any forgotten medicines.
I see. Now, regarding your menstrual history or OB score, how many times did you bear a child?
I gave birth to 3 children.
Okay, 3 children. And will you please tell me the year of your pregnancy?
1976, 1977, and 1981.
Okay, and so the total number of your pregnancy is?
3.
Are all of those delivered in its full-term pregnancy? A full-term pregnancy is the pregnancy that occurred for about 280 days or 40 weeks.
Yes.
Yeah, so they are all normal. No miscarriage or abortions?
Done.
Are they all alive and well?
Yes.
Yes. That is good to hear, ma'am. So, regarding your social history, Lola Nene, are you smoking?
No.
Are you drinking alcohol?
Yes, during special events like New Year's.
Okay, how about recreational drugs?
No.
Okay. And who do you live with right now?
I currently live with my 2 apos.
Okay. So, regarding your diet, what is your diet composed of?
I'm allowed to eat anything as long as I am maintaining my sugar.
Okay. Maintain your sugar. What are your hobbies?
I do a lot of gardening.
Gardening. Do the symptoms you experience hinders you from performing daily tasks like gardening, your hobby?
Not really.
Okay, regarding your family, you said a while ago that you currently live with your 2 apos. And what are the names? May I know their names or nicknames?
Marie and Anne.
So, regarding Marie, may I know what is the age of Marie?
Marie is 19.
What is their health status? Is she healthy?
She's healthy.
Do they experience the same symptoms as you?
No.
That's good to hear. How about Anne? What is the age of Anne?
She's 21.
21. And what is their health status?
Healthy.
She's healthy as well. And do they experience the same symptoms as you?
No.
Okay. Okay, ma'am. Regarding your genogram, Lola Nene, did your late relatives have health problems? What were the issues and when were they diagnosed? And what is the reason for their deaths?
My mother died from diabetic-related complications, which is heart attack. My father died from cancer of the lymph nodes, which spread to the bones. And my oldest brother died due to cardiac arrest. He also was diabetic.
I am sorry to hear that. And may I know how old are they when they died?
My mother died at ages 78. My father died when he was 60. And my oldest brother died when he was 64. Almost 65.
I am sorry to hear that. How about living relatives with previous or present illnesses?
My younger brother is also diabetic and currently has colon cancer. And my younger sister is also diabetic. Both my daughter suffers from migraines, while my son suffers from gout and migraines.
I'm sorry to hear that, Lola Nene. I hope they will get better soon. Lola Nene, thank you for answering all of my questions, and I know it was a lot. So at this point, I'm just going to look over you in a bit, and I will do a head-to-toe assessment. And is it okay with you, ma'am?
Yes.
Okay po. That's good to hear, Lola Nene. And please let me know if you feel any pain right now so that I will be able to assist your needs. Now, Lola Nene, we will proceed to your review of systems. And I will ask you questions, and all you have to say is yes if you experienced it and no if not. And we will proceed to your health in general. Do you experience any problems with lack of energy?
No.
Explained weight gain or weight loss?
No.
Loss of appetite?
No.
Fever?
No.
Night sweat?
No.
Pain in jaws?
No.
When you eat, you don't feel any pain in jaws? Scalp tenderness?
No.
Prior diagnosis of cancer?
No.
Okay, that's good to hear. Regarding your ears, nose, mouth, and throat, do you have any problems with difficulty with hearing?
No.
Sinus problems?
No.
Runny nose?
No.
Post-nasal drip?
No.
Ringing in ears?
No.
Okay. Mouth sores?
No.
Loose teeth?
No.
Ear pain?
No.
Nosebleeds?
No.
Do you experience sore throat?
No.
Facial pain or numbness?
No.
With your heart and blood vessels, you don't experience any problems with irregular heartbeat.
Yes.
Racing heart?
Yes.
Do you experience any chest pains?
No.
Are your feet or legs are swelling?
No.
Okay, and do you experience pain in the legs while walking?
No.
With your lungs and breathing, do you experience in shortness of breath?
No.
Night sweats?
No.
Prolonged cough?
No.
Wheezing?
No.
Sputum production?
No.
Prior to tuberculosis?
No.
Pleurisy?
No.
Oxygen at home?
No.
Okay. Coughing up blood?
No.
And do you have any abnormal chest x-ray?
No.
Okay. With your stomach and intestines, do you experience any problems with heartburn,
No.
constipation,
Yes.
intolerance to certain foods,
Yes.
diarrhea,
No.
abdominal pain,
No.
difficulty in swallowing,
No.
nausea,
No.
vomiting,
No.
blood in stools,
No.
unexplained change in bowel habits,
No.
incontinence.
No.
Okay. With your kidney and bladder, do you experience painful urination?
No.
Frequent urination?
Yes.
Urgency?
No.
Bladder problems?
Yes.
With your muscles, bones, and joints, do you experience any joint pain?
Yes.
Aching muscles?
No.
Shoulder pain?
Yes.
swelling of joints,
No.
joint deformities.
Yes.
Do you experience any back pain?
Yes.
With your skin, hair, and breast, do you experience any persistent rash,
No.
itching,
No.
skin lesions,
No.
change in existing skin lesion,
No.
hair loss or increase of hair,
No.
breast changes?
No.
Okay. With your brain and nerves, with your neurological system, do you experience frequent headaches,
No.
double vision,
Yes.
weakness,
No.
change in sensation,
Yes.
problems with walking or balance,
No.
dizziness,
No.
tremor,
No.
loss of consciousness,
No.
uncontrolled motions,
No.
episodes of visual loss?
No.
With your mood and cooking, do you experience insomnia,
No.
irritability,
No.
depression,
No.
anxiety,
No.
recurrent bad thoughts,
No.
mood swings,
No.
hallucinations,
No.
compulsions?
No.
With regards to your endocrinologic system, do you have any problems with intolerance to heat or cold?
No.
Do you have menstrual irregularities?
Yes.
Do you experience frequent hunger, urination, or thirst?
No.
And do you experience any changes in sex drive?
No.
With regards to your hematologic system, do you experience any problems with bleeding?
No.
Do you bruise easily?
No.
Do you have anemia?
No.
Do you have abnormal blood tests?
No.
Do you have leukemia?
No.
And do you experience unexplained swollen areas of your body? Okay. With your allergies, do you have any seasonal allergies?
No.
Do you experience hay fever symptoms?
No.
Do you experience itching?
No.
And do you experience frequent infections?
No.
Are you exposed to HIV patient?
No.
Well, and then, in order for me to assess and evaluate your health condition, and in order for me to record it, I will be determining your health status by 11 categories. And we will start off with your health perception or health management. So, how has your general health been?
Good. Nothing special has happened lately.
Okay. What are the most important things you do to keep healthy?
I make sure to drink my prescribed medicine on time, look out for sweet foods, and I do a lot of walking and gardening.
Are you immunized? If so, what are the vaccines are you immunized with?
Anti-pneumonia and the COVID vaccines.
When and what is your last immunization?
COVID-19 booster vaccine last January 2022.
Okay po. Do you have any allergies, Lola Nene?
None.
Have you undergone surgery in the past? If so, what type of surgery?
Total hysterectomy.
Total hysterectomy. When was your last physical examination and for what purpose?
Last December 2021, whole abdomen and blood test and breast ultrasound for my routine checkup.
Okay. Are you drinking medicines lately?
Yes.
Do you know what those medicines are for?
For my thyroid maintenance and diabetes.
Okay. Okay, Lola Nene, regarding your nutritional metabolic pattern, will you please describe to me what is your typical daily food intake?
I eat 3 times a day plus snacks and I eat a lot of fruits. I usually don't eat a lot of rice.
Okay, do you take any supplements?
Yes.
Yes, and how about your daily fluid intake? Will you please describe it to me?
I take about 5 to 6 glasses of water only. I also drink coffee in the morning.
Okay. Did you experience any weight loss or weight gain?
I haven't gained any weight and I noticed that I'm becoming skinnier.
How is your appetite?
I am full of appetite.
How about when eating or drinking? Do you feel any discomfort?
None.
Do you have any food restriction regarding the disease point of view?
I'm not allowed to eat too much fatty foods, those rich in sugars, and too salty foods.
Okay. Do you have any food restriction regarding your religious point of view?
None.
Do you have any food allergy?
None.
How about your skin or scalp and your nails? Are there any problems with those?
None.
Do you have any dental problems?
None.
Okay, Lola Nene. How about your bowel elimination pattern? Do you have any problems when it comes to passing defecation?
I don't find anything unusual.
That's good to hear. And are you using any laxatives?
No.
None. How about your urinary elimination pattern? How frequently do you pee? And what is the color of your urine?
I pee 4 to 6 times a day, but I don't really pay attention to it because I don't find anything unusual.
Okay. Do you notice any discharge? If so, what is the color of it and what is its other description or characteristic you can tell me?
I do have discharge, but nothing unusual.
Okay. Do you have any breathing problems such as apnea, hypoxia, hyperxemia, or hypercapnia?
None.
Do you have a cough right now or within the last 7 days?
None.
What type of exercise you do, Lala Nene? And how frequently do you exercise a week?
I don't have an exercise routine, but I walk a lot in order to manage my garden.
Okay, do you feel pale during exercise or during the time where you're gardening?
No.
Do you have any spare time activities?
Gardening.
Gardening. Did you notice any changes in your heartbeat during those exercise?
None.
Do you think that you are generally rested and ready for daily activities after sleeping?
Yes.
Yes. And do you have any sleep onset problems and such as dreams or nightmares?
None.
Do you experience an early awakening?
No.
No. How long does your rest or relaxation period?
I have about 4 to 5 hours of sleep at night, and I also take a nap in the afternoon.
Okay. What do you feel after walking? Do you feel any headaches, drowsiness, or are you feeling refreshed?
None.
Okay. So, do you use any medication for sleeping?
No.
Okay. So regarding your cognitive perceptual pattern, do you experience any hearing difficulty?
No.
So you're not wearing any hearing aids?
No.
Okay. How about your vision? Do you wear glasses? And when was the last time that you were checked up for the eye?
I do wear glasses, and I got my eyes checked last February 3, 2022.
February 3, 2022. Do you notice or did you notice any changes in your memory lately?
No.
No. Do you find it easy making decisions or you're having a hard time?
No.
No? What do you mean with no po? You find it easy making decisions?
Yes.
Yes. Okay. What is the easiest way for you to learn things? And do you have any difficulty in learning those?
I learn easily through reading, and I don't have any difficulty in learning.
Okay. Now, with regards to your self-perception or self-concept pattern, how would you describe yourself? And most of the time, do you feel good or not so good about yourself?
I would describe myself as healthy and beautiful. Of course, I feel good about myself.
That's good to hear po. And are there any changes in your body or are there things you can't do?
I do feel more restrictions in my movement.
Okay. Are there any changes in the way you feel about yourself and your body since your illness started?
I feel the same as before.
Okay, so you feel still beautiful and healthy.
Yes.
Yes. So what are the things that frequently make you angry, annoyed, or anxious?
I mostly get annoyed when some places in my house are messy.
Okay. Same po. And did you ever feel that you lost hope and you're not able to control things in life? And if so, what helps you during this kind of situation?
No.
Hindi naman po umabot sa ganun na point. Yes, that's good to hear po. Regarding naman po with your role relationship pattern, you said that you're living with your 2 grandchildren, right? And what is your role in the family?
I am the lola of the family.
Does your family depend on you for things? And if so, how are you managing?
No, my family consists of my children, and they are capable of taking care of themselves.
That's good to hear po. If you are in the hospital, for example, who will perform your responsibilities?
My children take care of most of my paperwork and accompany me.
Okay. May I ask if all the family members are cooperative with you?
Yes, they are.
That's good to hear po. Do you belong to any social groups? Do you have any close friends? And if not, does it make you feel lonely?
I don't belong to any social groups, but I do have friends from school and neighbors that I talk to sometimes.
Okay po. Do you feel part of the neighborhood where you are living?
Yes.
Okay. So regarding your sexuality reproductive pattern, Lola Nene, for you, are sexual relationships satisfying? What are the changes in yourself that you experience when you involve yourself in a relationship?
Yes, it is satisfying. I can't remember any changes in myself because my deceased husband was the last person I was in a relationship with.
Okay. Do you have any sexual problems?
None?
That's good to hear. If you are sexually active right now, do you use any type of contraceptives?
No.
When does your menstruation started? And when was your last menstrual period? And if you are no longer experiencing menstrual cycles, when did you experience your menopause?
I experienced menopause after my total hysterectomy, which happened during my 40s.
What is the time when you were in the hospital for a surgery? Okay. Regarding your coping and stress tolerance, let's say that you are stressed right now. Lola Nene, what are the things you do, you can think of to cope up with your stress?
Gardening and watching TV shows.
Okay, do you tense a lot of the time? And if so, do you use any medicines, drugs, or even alcohol?
I don't really get tense and I don't use any drugs, medicines, or drink alcohol.
Okay, do you have any big changes in your life in the last year or last 2 years? Like crisis or something?
Well, my husband died recently and it is really a big change in my life.
Regarding your value belief pattern, do you have any important plans in the future?
None. I do want to travel as soon as the pandemic ends.
Okay. What is your religion? Is your religion important to your life?
I am a Catholic and it is very important to me.
Do you offer prayers?
I do.
Will being here interfere with your any religious practices?
No.
Are there any other things that we have not talked about that you would like to mention?
Nothing in particular.
Okay, Lola Nene, thank you for being cooperative with me throughout the assessment and evaluation. Now I will take your vital signs. Is that alright with you?
Sure.
Now, Lola Nene, I will assist you and I will now take your height and weight measurement. So, okay, Lola Nene, thank you for being cooperative with me throughout the assessment and evaluation. And now, I will take your vital signs. Is that alright with you? Okay, now I will take your body temperature. And is it okay if I put this on your underarm? Yes. Do you feel any pain right now? Eyes open. Now I will take your pulse rate. Kukunin ko yung kamay mo at naman. That is all for your assessment, Lola Nene. Let us wait for the doctor in the waiting area for the diagnosis. And thank you and have a good day.